4 cc's of allograft. We're going to put 3 cc's in the medial knee at this angle. This is cryospray ethyl chloride to numb the skin. We don't like to use lidocaine if we don't have to. There's a risk of damaging the cells. So we put 3 cc's of the umbilical cord allograft in the medial knee. You get a Band-Aid ready. And this is done under knee decompression, which will let the needle go in more smoothly and draw the cells in that medial knee joint space. Doing good, David?
Yeah.
Doing awesome. It's going like butter.
Okay, this is half of the syringe.
Okay, so let's put up to 3.
3? Okay.
Yeah, and we're going to save 1 for the lateral knee.
Oh, 1. 3 and 1.
Perfect. Let's get that bandage on there. Does that feel more than 1 mosquito bite going in? Nothing at all,
I
right?
have pretty high tolerance.
There's no mosquitoes in California, so.
No, Florida.
Yeah. As you can see, because we are using the knee decompression system, the cell's going real smoothly. Now we'll put the remaining allograft in the lateral knee. So it's going to be at this angle, just like that. Okay.
Right there, right?
Yep. Perfect. Because the majority of arthritis is in the medial knee, that's where we put most of the cells. But because most of his pain is in the lateral knee, we're going to direct some cells in the lateral part too. There you go. And what we're going to do to help bioactivate those cells, find the scanner. So David, what I'm going to do is I'm going to actually irritate your knee joint with the myofascial release tools. What this is going to do is it's going to create local temporary inflammation. In this respect, inflammation is a good thing because this is what bioactivates the stem cells. Stem cells go where there's inflammation, it activates them. It creates something called paracrine signaling, which will draw not only your body's dormant stem cells you were born with, but the stem cells that we actually grafted in. As you could feel, it'll also kind of loosen up and break up some of those adhesions and scar tissue. The skin will be a little red. It'll increase blood flow to the area, which we want. Part of the healing process, we break down the scar tissue and adhesions, which stimulates the body's healing processes, pavementing, rolling to make normal fascial planes. I have the concave tool, or this is good for now. We call this one the boomerang, it's concave. We kind of get deep into the joint a little more.
Feel painful?
This is probably more painful than the actual injection, right?
Yeah.
Yeah.
Maybe it feels good even. So we're going to activate those cells there. We have the other tool right here, the can opener. Open that. Yeah. Wait till we get to Jack the Ripper, okay? So these are called laser edge myofascial release tools I developed. It has a gripping. The original Graston tools are quite slippery. I've made them more contoured, so they're more comfortable for the patient and for the practitioner. You don't have to white knuckle them because it has a masking grip. And I'm going to go ahead and activate the lateral knee. So again, I put the emollient for the lubrication. Not only does this irritate the tissue to activate the stem cells, but it actually spreads the injection fluid around the area so you don't get that pressure buildup pain. I've got a lot of adhesions around. This is where our main pain is, right around here.
Yep.
Yep. Probably feels good to break that up, doesn't it?
A little bit.
A little bit.
It's not bad, actually.
Yeah. It's necessary. Think about think of it, we're doing arthroscopic surgery on the outside. We're breaking up all those adhesions. Right? This will draw the cells in that exact area where he's having the arthritic pain and inflammation. I attack this about a 45-degree angle to really take advantage of that edge right there. Thus laser edge tools. I'm going to give him a shot of the high-powered class 4 laser. Let me know if it gets too warm, Dave. It gets hot pretty quick. So this will also enhance the healing process, get some heat in there, cause some photobiomodulation, which will stimulate those stem cells, create blood flow, circulation, get ATP energy in the cytochrome C process, which is in the mitochondria, which is the powerhouse of the cell, to get more cell production, stimulation. So basically what the laser does, it helps make sure the cells stay in the target tissue, which is the medial and lateral knee, so the cells adhere. They stimulate the cells to repair and stimulate the cells to regenerate and proliferate, because we want them to start growing as well when they're inside the body. After we do that, we use the light emitting diode panel, light stem panel, the same panel we use to defrost the cells and make a homing signal with the light. Now what the cells are going to do, they're going to look for that homing signal of light, so they're going to stay in the target tissue with the medial and lateral knee. So we're doing several things to make sure the cells stay in the target tissue. We've got the infrared laser thermometer targeting, the guidance system, the knee decompression, the high-powered laser, and we got the general light emitting diode to stimulate the cells to stay, repair, and regenerate.
In that spot.
Yep. And we did the myofascial release tools to create local inflammation to activate the cells. Not only the cells we grafted in, but your own natural stem cells that you were born with, dormant cells. Okay.
Yep.
So let that stay for a half hour. Okay.
Yep.
And after this, we'll give them some of the pulse electromagnetic field therapy to actually stimulate the cells more after.
The
Okay.
injection's done?
Injection's done. That's it. Yeah. The majority is of biohacking the body to get those cells
You
growing.
want the souvenir?
Sure.
This is-
That's how I do it. Thanks for
you can
watching.
Look at this.